AM 1160 and WCCSradio.com. Good morning to you. Thanks so much for being with us. 12 minutes after 9 o'clock. Oh, we have things to talk about this morning. We certainly do. We have many things to talk about this morning with Dr. Timothy Makkar, IRMC Dermatology, now practicing at IRMC at Chestnut Ridge. Our visit this morning is presented by Marcus & Mack, voted best law firm and best personal injury lawyer 4 years in a row in the Best of Indiana County contest. Visit them online at marcusandmack.com. Good morning to you.
Good morning, Todd. It's very nice to be here.
I'm glad you're here with us here today. You've been at IRMC for not a long time. How long?
Yeah, about 4 months now.
About 4 months?
Yeah.
Going well?
Going very well. We have a great team, and the patients have been wonderful, and I think things are going really smoothly.
Well, let's introduce you to folks. You're from where?
Pittsburgh.
From Pittsburgh. I've heard of that place. Born and raised?
I was born in Ohio, and then I came to Pittsburgh when in like elementary school.
Yeah.
So most of my life there, and then traveled about a 6-hour radius for most of my school.
Mm-hmm. Mm-hmm. Where'd you go to high school?
I was at North Allegheny for high school.
North Allegheny.
Yes.
It's a nice school. I like going there.
Yeah. It was a good school to go to.
Yeah. And med school? Where'd you go there?
Med school is at the University of Virginia School of Medicine down in Charlottesville. And if you've never been there, it's very beautiful.
Yeah, it
very
is.
nice grounds. The whole little town of Charlottesville is just a wonderful place to be for a few years. Yeah.
Yeah, it really is. We were down there a couple of years ago and went to the presidential homes. Of course, you have to do that.
Yes.
But then the campus itself.
The grounds are some of the most beautiful. Like when you're on the lawn, it's really nice. And the whole place has a very, very academic, very cultured feel. And, I don't think there's anywhere better I could have gone for school.
Seems to me if you went to University of Virginia, you should have gone to Thomas Jefferson High School instead of North Allegheny.
There are a lot of people who go to Thomas Jefferson High School, especially in that area.
Yeah. All right, let's talk a little dermatology with Dr. Timothy Makkar. And, we were talking earlier this morning. We had somebody in who had just come in from outdoors, and her cheeks were all flushed because it's so cold and the wind and everything. This is actually a pretty dangerous time for your skin, isn't it?
It is a time where skin conditions flare. It is a time where winter itch is very common. It can flare people's eczema. Sometimes it brings out contact allergies that have been a little bit dormant when the skin barrier was doing better. It flares people's rosacea like you're alluding to. There's a lot of different skin conditions that can flare in the winter. And of course, like things like skin cancer, they can show up at any time. So sometimes, they're coming out in the winter, even if it's, you don't think of the sun that you got recently. That's our most common thing is people say, oh, I haven't been in the sun much the past year. And it's like, no, a lot of it's the sun that you got 20 years ago, 30 years ago.
Yeah. And it gets magnified in the wintertime when the sun comes out and hits that white snow.
Yes, yeah, it can definitely reflect, and they've done some studies on skiers, and skiers, will still get sunburned.
Talk to me about the lips. The lips are vulnerable, aren't they?
Yeah, the lips are one of the areas, actually, the AAD kind of goes through some areas where people forget that they can have skin cancer, and the lips are one of those areas because people don't think about them. They don't often put sunscreen on their lips because they're, worried about what it might taste like or, getting it in their mouth, they just forget. But lips definitely burn, and actually skin cancers on the lips are particularly high risk. So, it's a part of our skin exam every time someone comes in for a head to toe. We do look at the lips. We look at the oral mucosa. We look at the eyelids. We have them close their eyes for a second. We do try to make sure that those areas that people don't think of are things that we check, because those are areas where things can go a little bit longer than you'd expect. And then if you don't take care of them, they'll start to cause problems.
Yeah. And with the winds of winter as well, moisturization is really important.
Yes, chapped lips, very uncomfortable. People get cheilitis of the lips, basically when the corners of their mouths are getting chapped. And, those are very common things that we see people deal with all season. And then in the winter, that's when they present, when they're getting really unbearably uncomfortable.
All right. So you mentioned skin cancers. And when people think of the dermatologist, they think of two things. Number one, they think of acne. Number two, they think of skin cancers. And both are very common. We were just talking about a Fox report about menopausal women, and how acne is coming back on menopausal women, and why that is. A new report in from Fox Health on that. But acne is one thing that a dermatologist will deal with. Skin cancers are always a risk for everybody, aren't they?
Yes, that's true. Acne and skin cancer, we see so much of both. Those are probably the two most common reasons for visits that are in our clinic now. And like you said, acne can present at any age. Certainly, we have our majority of patients are teenagers, 20s, but we do have women into their 40s, 50s, men who, have really bad acne and they're tired of dealing with it. And, they've been putting it off or it's suddenly flaring and we can clear them up and they're suddenly like they've got a new smile on.
Yeah.
So.
And the skin damage that we do, you mentioned it, when I had one of your predecessors that I went to that told me one time, all that stuff that we have to keep freezing off your face, that's from when you were 4 or 5 years old. Because back then you go outside in the sunshine, you didn't have any clothes on and it didn't matter.
Yes, yeah. We have lots of people who use tanning beds, use baby oil to go tan, worked outside, never thought of sunscreen a day in their life. And, when they hit 60 and they start going for the screening exams, they start using sunscreen, but it doesn't undo, all the sun damage that they had before. And sometimes, even people who didn't have a ton of sun can still have, because of their genetics, because of luck, because of a few bad burns, they can have skin cancers at earlier ages too. So, it's not always the most common patients. Sometimes, even people who you would think are low risk are patients that we see with skin cancer.
Yeah. So in my family, I come from a family of freckle-faced, red-headed Irish people. That's right in the wheelhouse, isn't it? That's the demo group.
Yeah, so that's the group that they say is about 30 times more likely than say someone with a very darker skin type. You're still about 30 times more likely than one of those people to get melanoma or basal cell. That said, I have seen and treated skin cancers in every skin color. But certainly, if you have fair skin, if you've gotten a lot of sun, those are the risk factors that you should really be coming for like an annual exam and looking yourself over every month or two to make sure that you don't notice anything new, growing, bleeding, painful, changing colors. Like those are the things that, you should be looking over yourself every month or two and, on a regular basis also being seen by a dermatologist to help pick up subtle things that are changing early.
Dr. Timothy Makkar with us this morning. All right, let's talk a little bit about screening because there are people who have never gone to the dermatologist and never gotten that screening that we're thinking of and that we're talking about here this morning. Why is it important? Why is skin cancer something to be very serious about?
Because it's something that you often don't realize is causing problems until it's too late, especially with melanoma. And I will say, like you mentioned, a lot of patients have never thought to themselves that they should get a skin exam. And that's something that if you're in the dermatologist for another reason, sometimes, if we've already fixed your problem, we'll try to offer you that, to say, hey, if you've never had a skin exam, and you're 65 years old and you worked in the sun, or, even you don't have those same risk factors, but you've never had a check, we can do that for you while you're here today. And already in my time here, we've caught melanomas that were in patients who were coming for different reasons, different rashes. And then they follow up the rashes better. And I say, since we don't need to do anything else with your rash, have you ever had someone check your back? And, we find skin cancers that if we hadn't caught in 6 months might be in their lungs.
Yeah.
So those are things that, we try to really remember that it's not just addressing what you came in with, but trying to make sure that nothing related to your skin, hair, and nails is going to cause you any harm that we can prevent.
So where with other doctors or other conditions that we think of going in for screenings, we might think of them, okay, once you reach a certain age, you should start going in for screenings for this or for that. Not so much with skin. You should not worry about age, just you ought to be going.
So that's a really interesting question because there are no official guidelines from the USPTF, the United States Preventative Task Force, on an age for skin cancer screening exams. That said, American Academy of Dermatology, which I agree with, will say that anyone who's had a family history of melanoma, they should probably get screened from an earlier age. And then for patients who don't have a family history of skin cancer or significant risks, usually a baseline exam in their 20s and then just kind of following up as needed, depending on whether they have a lot of moles, whether they're doing their skin exams on their own, whether they're on any immunosuppressants. Those things can all affect the risk. A lot of times there are predisposing conditions that can increase your risk. But if you've never had a screening exam and you have a lot of moles, or you have any moles that you're concerned about, it's certainly a good idea.
So with a dermatologist, we think about those prevailing conditions, about skin cancer screenings and acne, as we mentioned. There are other reasons to see a dermatologist, other services that you offer as well.
Yeah, so things like rosacea, psoriasis, vitiligo, blistering diseases, allergic contact dermatitis, hair loss, nail changes, cosmetic reasons. There are a lot of reasons people will see us. We have genetic conditions that we see. I'd say what's interesting about dermatology is, every day you will be surprised by at least a few patients walking in who have something that is pretty uncommon in Indiana, because I think there's been a lot of patients who've lacked regular access to dermatology care. We see patients with pretty advanced conditions, and we're used to taking care of them. Yeah,
that's interesting.
And because we are affiliated with IRMC, and IRMC has their cancer center, we work closely with the general surgeons, the oncologists for high risk patients. And certainly, it's good that we have that system that no matter whether your needs are simple or complex, we can take care of you.
Is dermatology a field where the changes and the new therapeutics are constant like some others? Are there new treatments coming out? I guess I'm getting at new treatments coming out for people who have damaged skin and can recover some of the elasticity to their skin, maybe cover up the scarring a little bit better, heal some of those?
So definitely we have tons of new therapies, whether you're talking conditions like psoriasis, where the biologics that work on the immune system have made patients who used to be covered head to toe now clear, or you're talking more like undoing some skin damage, then yes, we have things like microneedling. There are lasers like IPL or CO2 that can help with pigmentation or resurfacing. There are new injectables that can help promote hyaluronic acid regeneration and kind of provide some elasticity back to the skin. I do fillers, I do Botox, we do peels. They kind of all work to undo some of the changes of aging and kind of slow those down. We also talk about skincare, about what kind of pharmaceuticals or other over-the-counters we can use to try to minimize the skin signs of aging. And obviously, I would be a fool if I didn't mention that, using sunscreen is going to be one of the key things to prevent skin signs of aging and skin damage. So if you're listening, you should be using sunscreen.
Sunscreen is not just for the beach.
Correct. Yeah. Most of the sun you get in your life is not going to be days you're at the beach. It's going to be days you're just walking around. People in their cars get a lot of sun. If you left your house, you probably got some sun that day.
Yeah. Oh my goodness. All of the many, many hours, days and days I've spent on a tennis court with.
And our clinic is on a golf course. So, we have a lot of golfers who've gotten a lot of sun during the time they were golfing. And some of them wore sunscreen and still got sun, and some of them didn't, and they have a little bit more to show for it. But, sun protective clothing, sunscreen, definitely very important.
And learn to like hats.
Yes, hats are great. So I think, there's multiple ways to protect yourself from the sun. So some people who are really, don't like one way, they can use some of the other methods.
He is Dr. Timothy Makkar. Somebody wants to set up with IRMC Dermatology. What should they do?
So they can call our office at 724-459-1727, and we'll get you scheduled.
Beautiful. Hey, thanks for the visit today. Good to meet you. Good to have you here on Indiana in the Morning.
Very good to see you, Todd. You have a great one.
It's the voice of Indiana County, WCCS, 101.1 FM, AM 1160, WCCSradio.com, 9:26 in the morning. Matt is in the WCCS newsroom. He's coming up. So is Westwood One Sports, brought to you by S&T Bank, People Forward Banking.
Tired of the cold and shoveling snow? Same. This year, make an easy escape from winter by switching to S&T Bank. With online and mobile banking, you are always in control. Set savings goals, track your budget, and transfer funds faster than you can say, "Pina colada, please." With convenient locations and ATMs, we'll make planning your next tropical trip a breeze. Stop by your local S&T branch, visit stbank.com, or call 800-325-2265. Banking made easy so you can spend more time in the sun. S&T Bank, member Member FDIC.
This is a Westwood One Sports Minute.
Sponsored by TaxSlayer. Start filing for free today at TaxSlayer.com. The Cleveland Browns have hired a head coach. Psych. When will the rain end? When will the sun come out for Cleveland Browns fans? Due process is over, and none of the big coordinators in the Super Bowl seem to be viable options or options that want the job. That's bad. I'm Drake Toll.
When I wake up
The best mornings
in the morning light,
start with Wrangler.
I pull on my jeans and I feel alright.
Jeans, jackets, and shirts that get your day started. Good mornings make for better days. Wrangler, for the ride of life.
My name is Whitney Allen. I am a widow. My husband Ryan died. We never thought in a million years we'd have to use life